I think it gives you an additional level of safety. But you can ask, many doctors are in favor of it. Many frontline workers won't go there unless they have the hydroxy.
There's no real indication, no evidence base for the use of hydroxychloroquine as a preventive of COVID-19. I think doctors ought to not be prescribing this medication to people across the country for this purpose.
Well, President Donald Trump recently said he was taking hydroxychloroquine as a preventative measure against COVID-19. But these claims are certainly controversial. Hydroxychloroquine is used to treat malaria, lupus, and rheumatoid arthritis. And early on in the pandemic, the drug was hoped to be a treatment for the coronavirus, but new research disputes those claims, and doctors are now seeing a dangerous reaction to the drug. They say hydroxychloroquine could cause heart damage or even death. So to talk about the dangers, we're joined by cardiologist Dr. Ernst von Schwarz. And thank you very much for joining us, Doctor. A recent study put the brakes on it by the World Health Organization. Can you touch on that a little bit on their findings?
Yes, absolutely. Good morning, Javier. Thank you very much for having me on. Good morning, Arizona. As you know, according to Mark Twain, I'm an expert. An expert is someone who knows as much as you do, but is from out of town. So let's talk about the hydrochloroquine. This drug is very well known to us since many, many decades. We use it for malaria. We use it for certain connective tissue diseases like lupus or arthritis. But the drug has, of course, significant side effects. If you look now at the recent studies which have been published, starting this month, in fact, in contrast to initial anecdotal reports which showed some possible benefit of hydroxychloroquine in COVID patients, the current studies have not shown that, just the opposite. The latest registry, which was published just a few days ago in Lancet, May 22nd, looking at almost 100,000 patients where 16,000 received hydrochloroquine for COVID-19, showed zero benefit, just the opposite, an increased risk of even death of up to 45% in patients who took the drug. Other studies, such as one study from China in 150 patients, showed no benefits, but also an increased risk of significant side effects. A study from France, published also this month in 181 patients, same thing, showed no benefits, but significantly more side effects. So at this point, the World Health Organization even yesterday announced to put a hold, a stop on its ongoing trial using hydroxychloroquine for COVID patients. So in my opinion, it should not be used.
So let me ask you this, because Indonesia actually rolled it out in treatment of mild or severe cases of the coronavirus. I know the WHO told them yesterday to stop that, but they were claiming there were benefits. So are there benefits? And if there are benefits, do the dangers outweigh the benefits at this point?
I think so. Thank you, Javier, for bringing this up. I definitely think so. I mean, there's different kind of study designs, as you know very well. And initial studies, including the Indonesian study, which you mentioned, have shown some anecdotal possible benefits. However, I mean, if you want to know for sure, you need a randomized controlled trial, and the few randomized controlled trials, meaning versus a placebo, have not shown any benefits. Keep in mind, the side effects of hydrochloroquine are significant. I'm a cardiologist, so I had patients and friends calling me for weeks now to prescribe hydroxychloroquine to them as a preventive measure. But I have to warn, the side effects for the heart is not only arrhythmias, irregularities of the heart, but also, as a transplant cardiologist, I have seen patients who developed heart failure, meaning a weakening of the heart. And if you look in the literature, there's data that patients even needed transplants or died as a result of cardiac toxicity of hydroxychloroquine. So even though the verdict is not completely out yet, it should not be used. And as you know, the FDA even published a warning, a cautionary note note a few weeks ago that definitely it should not be used outside the hospital setting. Because if you take it, you need to monitor the heart, you need to look at the heart rate and the rhythm, and you need to look at the function of the heart. As you know, there's people who sell kits, COVID kits, for a lot of money to patients to take as a preventive measure. With regard to the prevention, there's also no data whatsoever demonstrating any benefit of the drug at this point.
All right. Well, thank you very much. Always great to get a good perspective, even from an expert by Mark Twain standards. Have a great day, doctor.
Thank you so much. Thank you, Javier.